Well, good afternoon. Before I get started today, I just want to take a moment to say a few words about Dr. Reuben Devlin. My heart goes out to his wife Rhonda, his children, grandchildren, and the whole family on hearing the very sad news yesterday. He was a great friend and advisor to me and my family. He cared for my brother when he was sick, and he had the biggest heart anyone could have. And I will always be grateful for that and his passionate work to end hallway healthcare in Ontario. Dr. Devlin, I'll tell you, he was instrumental in putting together the first digital hospital, Humber River, and he took ownership of it. He was so proud of it. You know, most CEOs of hospitals, hand it over to the contractors, oversee it, but he was there every single day, looking at better systems, deliver healthcare, to bring in lean systems, one of the first hospitals to do that in Canada. And again, finally, finishing the hospital and having the first digital hospital in North America. This was the type of man he was, and I'll never forget on a personal note too, is, when Rob was going through his challenges and we were in the room together and talking to me and talking to Rob and always being there through tough times and good times. And life is really interesting sometimes. It was 2 years ago to the day yesterday when we were elected, and Dr. Devlin was standing beside me when we did our maiden speech there, and he was so instrumental in helping us down here and changing healthcare. So I just want to give my blessings to his whole family. I also want to thank Chief Saunders for his outstanding service to the City of Toronto. He's been great to work with and a true champion, a leader for the City of Toronto and the province. And I want to wish him all the best. And Chief, I had an opportunity, by the way, to call the chief last night, and I spoke to him and thanked him for his service. I also had an opportunity to speak to his amazing wife, Stacy. What an incredible partner, Chief, you have, and I mentioned that last night. And I said on the phone call, when I talked to Stacy, I said, Stacy, the chief is still young, and what's he going to do is hang around for a few months. And she said, well, there's only so long he can be hanging around. It reminds me of the story when my dad finally retired from the business and retired from politics, and he went home after 50 years of being married to my mom, and he was there for about 30 days, and out of one reason or another, after 50 years of coming home at 6 o'clock and really structured, all of a sudden, after my mom was, running the household basically for 50 years, he thought it was a good idea to come home and tell my mother how to run the household. Well, that, as I said, that didn't last long. So my advice to the chief, I give you about 60 days. You're too valuable to the city, too valuable to the province, and too valuable to Stacy. So anyways, I just want to wish you and your family all the best. My friends, yesterday we announced our plan to lift restrictions, get the economy going, and get people back to work. Working with our partners across the province, we launched stage 2 of reopening the economy. A responsible, safe, and regional approach. This plan recognizes the situation is different in different parts of the province. It's a positive step forward for hundreds of businesses and thousands of families across the province. There's more work to do, but as I said yesterday, I am confident the rest of the province will get to stage 2 very soon. But before we get there, to help Ontario families, we need to make sure supports are in place so people can have peace of mind going back to work. That includes our plan for childcare. As a father, I know there's nothing more important than the safety of our children. Parents returning to work need to know that someone they trust will be there to care for their child in a safe and healthy environment. So today, we're providing more information on the next phase of our plan to reopen childcare. Starting Friday, June the 12th, all childcare centers in the province will be allowed to reopen with some restrictions. These restrictions will be just like the ones we've seen in the emergency childcare centers open already. There will be limits on the amount of children in the centers at one time. There'll be more screening and more cleaning, and childcare centers will be able to reopen once they meet these guidelines. I want parents to know we will take every measure necessary to keep the kids and the staff safe and healthy. And for older children, we know there's been a lot of questions around camps. Summer day camps will also be allowed to open with some restrictions as part of stage 2. In coming weeks, we'll continue to plan for the next phase of childcare reopening and work on our plan to reopen schools. We'll keep parents informed so they can plan ahead. I want to thank each and every parent and guardian across the province during the last 3 months. In this unprecedented time, all parents and guardians have had the increased challenge of balancing work and family in this new normal. It's no easy task in normal days, but now more than ever, I know it's even tougher. You being there for your children, showing leadership and love during these challenging days, and together, you and your family, alongside the rest of Ontario, will emerge from this pandemic stronger than ever before. Thank you, and God bless the people of Ontario. I'll pass it over to Minister Lecce.
Well, good afternoon. We made a commitment to Ontario parents to ensure your kids remain safe and to ensure the parents can return to work with the confidence that their children are safe. Today, we are delivering on both objectives. As Ontarians return to work and as we look ahead to stage 2 of Ontario's reopening plan, we know that providing childcare for parents is critical to getting our economy back on track. As the Premier announced, childcare will reopen in stage 2, province-wide, with strict health and safety requirements in place. Nous aidons les Ontariennes et les Ontariens à retourner au travail en rouvrant les centres garde de manière sécuritaire. We are helping Ontarians return to work with the safe reopening of childcare. This plan was reviewed by the best public health and medical minds in Ontario, including experts at the Hospital for Sick Children. In fact, the rules will look a lot like the guidelines we've established to provide emergency childcare for frontline workers, and it's a model that we know that works. Let me lay out our plan that will keep kids safe. First, we are requiring operators to limit the number of kids and staff to a defined space to 10 people. All children, all staff will be screened for symptoms prior to their entry. We will not allow visitors in our centers. All centers will be thoroughly cleaned before opening and throughout the day. On top of this, we're directing the removal of all toys that could easily spread germs. All childcare centers must have a COVID-19 response plan if a child or a parent or staff is exposed to the virus, and is to keep daily attendance records to support contact tracing. Finally, the local medical officer of health must be supportive of these local reopening plans to ensure the highest standards of safety. Now, in-home childcare providers will also operate under enhanced health and safety requirements. Now, I know, and I think we appreciate that some parents may decide to not utilize their existing childcare space in the coming period. We will protect these parents by ensuring that you do not lose your spot nor be charged during this period of time. Now, finally, to underscore our zero-tolerance approach to non-compliance, we will be increasing penalties by $1,000 a day per child, or a net 50% increase in the penalty regime. We will also be stepping up inspections to ensure compliance and safety. Make no mistake, when it comes to your kids' safety, we are taking all precautions that you can return to work while having the peace of mind that your child is cared for. And like the Premier and the Deputy Premier, I just want to express our gratitude to Ontario parents for their sacrifice to date and their optimism in the future. Thank you.
So Ivana, before I start, I just want to give everyone notice, tomorrow a mobile testing bus will be in Brampton, and if you're worried you've been exposed to some someone who has COVID, you can go to the Gore Meadows Community Center from 10 a.m. to 6 p.m. I'll just repeat that. The Gore Meadows Community Center from 10 a.m. to 6 p.m. And this is one part of our strategy going right into communities.
Okay, we'll go to the phone line for questions. First question.
First question comes from Chris Rushley from Toronto Star. Please go ahead.
Hi, Chris.
Hi, good afternoon. My question is for Minister Lecce. If you're planning on smaller daycare class sizes, that means fewer families will be served, so centers won't be able to bring in as much money. Are you looking at any additional funding for centers?
Well, first off, I think one of the assumptions we're making based on feedback is that not all parents will send their children to childcare centers. So we believe we'll have sufficient capacity to enable parents to utilize childcare should they need it, given if they're returning to work as part of the stage 2 reopening. I should also note that home care will continue to be provided through this period. Now, with respect to funding, we have done quite a bit in the past weeks to leverage federal funds and as well as provincial funding to ensure stability in the sector. We want to ensure that childcare operators are there for parents today and well into the future. We know how consequential it is to labor market participation. I was speaking to my colleague Jill Dunlop last night, and she reminded me just how important it is for women to see childcare as a viable option in their communities. And so what I can assure you is, I can tell you what we're doing to help ensure that childcare operators remain sustainable. First is we are participating 37.5% in the rent program with the federal government. That is going to help the offsets for rent for these operators. The second is the emergency wage subsidy by the feds has been expanded to include childcare operators, in part because of Ontario's advocacy. The third, the Ministry of Education has actually extended additional support for operating funding for fixed costs, like for example, rent or insurance. And we have said that on a one-by-one basis, we will make sure we're there for operators on a need basis to get them through this difficulty. That is our commitment. But I think today's announcement, signals the government's priority on but not just stability of the sector, but protecting parents' financial interests by ensuring the emergency order remains in place. So should a parent not want to put their child back in a center, that is your choice. You will not lose your space, and nor will you be charged.
Thank you. And if there is demand for spots, are you going to be developing any sort of guidelines to help centers figure out which families should get priority spots?
Yeah, thank you for the question. Right now, emergency childcare will end at the part of an orderly phase up on the 26th of June. That's part of our plan to phase out emergency childcare. We've given some notice about that some weeks ago, but I want to be clear to our first responders, to our emergency workers, to our truck drivers and our nurses and those on the front lines doing heroic work in the safety of our families. You will have first preference. You will ensure that our first responders and our emergency workers continue to receive that support in a post-emergency childcare world. So really, post-June 26th, that priority will be given to you. Keeping in mind, as I mentioned, Chris, the reality is not all parents will be putting their children back. So we believe with this plan, cohorting of up to 10, no more than 10, including the staff and the children in a defined space, should allow operators, should they want to optimize their full licensing capacity, and some will not based on space. But we think we will be able to get the workers, parents back into the workforce as soon as possible, and there should be sufficient space for them.
Next question.
Next question comes from Mike Crawley from CBC. Please go ahead.
My first question is for the Premier.
Mm-hmm.
Premier, I wonder if you could explain the logic in the decision to allow churches and other places of worship to have up to 30% of their capacity, but you're only limiting funerals and weddings to 10 people. Why?
Yeah, so I asked the same question, Mike. I'm glad we think the same way sometimes. When it comes to weddings, people congregate from all over the province, depending on who's invited, and for tracing purposes, it's a lot harder to track someone opposed to a church that everyone has to sign in who shows up, and that's the answer I got. And hopefully over the next few weeks, we'll be able to get back to normal. But that's the answer I got when I asked the question. It's fair enough.
Follow up.
Okay, my other question, you promised to be transparent with the public about the advice that you're getting from experts, but when CBC asked the government to say who's giving you the advice, they wouldn't identify them. So can you tell the public who are the infectious disease specialists and the epidemiologists that are providing that expert scientific input for your reopening plan, other than Dr. Williams?
Well, we've brought out a number of doctors, and a lot of doctors, personally, they don't want their names out there, but there's a host of different doctors, be it Dr. Hyder, Dr. Allen, Dr. Williams. What I think was really unfair with that article from CBC was how they insulted Matt Anderson. This is utmost professional, and about fighting COVID, it's not just about having doctors and specialists. It's a big part of it, but there's an operational side. And Mike, if it wasn't for Matt Anderson, I'll tell you, the testing would be half of where it is right now. He's instrumental. Matt works 7 days a week. I call him at 11 o'clock at night, he answers. I'll call him on a Saturday, I call him on Sundays. It was totally unfair. And I have to call you out and it's not you, Mike, but it was just a very poor judgment in my opinion. Everyone's trying, absolutely everyone. We have a host of doctors, and then those doctors talk to other doctors. And so that's the reason. But we've rolled out the health team, you know the names. But to say every single doctor involved, I'd give you a list of over 100 doctors. And certain privacy, they don't want their names out there, so I'm not going to roll that out. But the frontline people are out here answering questions. So that's it.
Next question.
Next question comes from Christina Tenalia from CP24. Please go ahead.
Hi there, Premier.
Hi,
I
Christina.
hope you can hear me okay. Hi, Premier. Hope you're well.
Yes.
So the Ontario Coalition for Better Childcare put out a list of recommendations of what they would like to see before childcare centres in the province can reopen. That includes a minimum of 3 weeks notice before reopening, and they say prior to which the sector must already have had access to sector-specific reopening guidelines, which specify new operating regulations and funding plans. They also asked for funding for and organized access to all necessary PPEs, and they say this should be provincially funded. Now, considering those are part of their recommendations, that was not included in today's announcement. How can parents be confident that childcare centres in the province are ready to safely reopen in 4 days?
I'll pass this over to Minister Lecce.
Yeah, thank you for the question. The advocacy group has called for a variety of initiatives by the government. They've called in part for having smaller numbers of students, of kids within a space. We've committed to that by going to a cohort of no more than 10. They've called for enhanced cleaning protocols. We are doing that. And with respect to funding, in the additional funding I mentioned earlier to Chris, the province is providing more latitude and more support, for example, for cleaning, for additional custodial staff that may be required within centres, including for PPE. That type of funding can apply for those types of ancillary costs imposed on our operators. We have given notice and as well provided guidelines to the sector. And I appreciate some operators will want to take the time to do the proper training and to open up, and that may take them some days, and we respect that. What we're signaling today and what we've sort of signaled quietly over the past week is that childcare can reopen, technically effective Friday as part of the realignment with the phase 2, but we know some of them will take additional time. And obviously our aim is to get this right, to do all of our due diligence to protect families and protect our kids and protect our staff. So when it comes to the overwhelming message I've heard from the association, we are delivering on it. And I obviously believe in continued partnership with them and an expression of gratitude to our workers in emergency childcare today and those that will be there tomorrow or in the coming days as we reopen. Just a signal that we're going to be there for you. We're going to continue to invest. We're going to continue to ensure the stability of the sector because we need parents and we want parents to have that optionality to return to work with confidence. And so this plan, not just endorsed by the medical officer and reviewed by Sick Kids, it really does reflect the priority of parents of the sector, which is stability for childcare operators, but also financial support and protection, consumer protection for parents.
And Minister Lecce, or perhaps this question is for Minister Elliott. One other thing the coalition called for is clear COVID-19 testing, a policy for clear COVID-19 testing. Now, at the end of May, Minister Elliott said in a couple of daycare situations, there was permission asked of parents for children to be tested, and they were. It's a special test. It's delicate. It's something that she says we will continue to do. And she says, and I quote, we want to make sure that as we open the economy, further testing of children will be required, but parental permission must be obtained. What happened to that?
Sure. I'll turn to the minister maybe to speak first.
Well, we did have an outbreak of COVID-19 at one of the essential childcare centers earlier, and we tested both the people who work there as well as the children, because we wanted to keep them safe to see if any of them had been exposed to COVID-19. If you're going to conduct a test of that nature, clearly you need to have the parents' permission. They're young children. You would need the parents' permission in order to do that. And you also need to have specialists there to conduct the testing, because they're very delicate nasal passages, and you need to know that there's someone there that can do that kind of pediatric work. So we will continue to do that. We're going to continue to monitor. We're going to continue to test, because we want to make sure that these are healthy and safe places for children. So that will be part of our ongoing testing that we're going to do in the community in any event. So children are our most important resource. We want to make sure that when their parents return to work, that they can know that their children are in a safe and healthy space. And if there is someone who comes down with COVID-19, that it will be important to test everyone with the parents' permission.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi there. Just had a question about PPE. So childcare centers are obviously, going to stock up on PPE. Who pays for that? Should the childcare centers charge families? Should they bear the cost, or is the government setting aside a certain fund for childcare centers for PPE specifically?
Well, Colin, I'm going to pass it over to the minister that's taking care of it.
With respect to PPE, as I mentioned, the government will provide ancillary supports to cover things like, additional cleaning. PPE will be required. There are additional supports the province is lending to operators, and that's been made clear in today's announcement. Of course, that's in addition to the funding and support on rent relief, on the emergency wage subsidy, because we're trying to ensure that the sector understands fully that we are committed to their sustainability and to the protection of our kids and our staff.
All right, thank you. My next question is for the Premier specifically, and it's on another topic. Premier, there are calls to defund police services right across North America. The OPP is a $1 billion operation under your purview. What are your thoughts on defunding police in general, and specifically your thoughts on defunding the OPP?
Well, I don't believe in that for a second. I think we need a strong police within our communities. What we do need to do is have higher standards. We need to focus on more training. I think I'm a big believer, as Chief Saunders always believed, in community policing. Get involved in the community, learning more about your community. That's what I believe in, but I just don't believe in, cutting police budgets. I just never believed in that.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Oh, hi, Premier. I do have a question about just public awareness starting on Friday, but I want to go back to what Christina was asking about a little bit with regards. So, if you can't get permission, does that mean that if you want to test and parents say no, that I'm assuming that means that the child cannot attend the daycare, and a little bit further in that, if you have an outbreak, if you have one case, will you shut down the facility?
Well, if we have one case, yes, we need to. We need to, number one, trace it and make sure we go in there and sanitize the child care facility as well. But again, they're people's children. They're going to have the right to say if they want them tested or not tested. We can't force anyone to test their children. I'd never do that anyways. Strictly up to the parents.
Follow up.
And Premier, if you could take this on as well, just with a little bit more about Friday. In terms of public awareness, there's, we see the commercials and the signs, but if you're going to have a lot of the province opening up now and you want them to follow the safety precautions, do you think that you need to do a little bit more when it comes to public awareness, reminding people about physical distancing, focusing on hand washing and sanitizer, disinfecting, etc.? Are you concerned about a certain level of complacency, and are we going to see that public awareness portion increase Friday, next week, and when Phase 2 eventually happens in Toronto and the GTA?
We have to be vigilant. We have to never let our guard down, ever. We always have to make sure we practice social distancing. We have to make sure that we're always washing our hands. And as for advertising, including your radio station, we've spent, not yours specifically, but yours plus others, over tens of millions of dollars in advertising. You can't turn on a radio station, you can't turn on television without getting an ad from the provincial government, the federal government. So we aren't sparing any expense when it comes to making sure that we inform the public. But I go back to the public's been incredible. They understand it, and they know what needs to be done, and they've been great. They've followed the protocol, and I have all the confidence in the world, and the people here in Ontario will continue following the protocol until we get out of this situation.
Next question.
Next question comes from Travis Denrush from Global News. Please go ahead.
Hi, Travis.
Hi there, Premier, and condolences to Dr. Devlin's family and yours, as I know you were very close to him.
Thank you.
I have a question that a lot of people are asking right now online about the rules and the rhyme and reason to the rules. Why is it okay to get a massage in Toronto right now, but you can't go and get a haircut? How does that make any sense?
Something I can't even argue with you on that. I'm going to pass it over to the Minister of Health. There's always a reason when they go through the table, but I agree. I need a haircut desperately, so we'll see what happens. I think things will start opening up very soon, but I'll pass over to the Minister.
Well, a lot of it has to do with physical proximity and closeness to the face-to-face with other people. That's why we know that dental services, for example, are resuming because of precautions and requirements from the college on what is safe and what people should be wearing, masks and facial shields and so on. The same is going to be true of salon operators that are going to be doing massages, things of that nature. And ultimately, for hair salons, manicurists and so on, where people are in close physical proximity face-to-face. And as we know, if someone sneezes, there can be transmission of the virus. So we just have to be very careful. That's the basis upon which these decisions were made. And we're going to continue to focus on that because we want to, as we gradually open up the economy, do so in a very safe and healthy way.
Okay, my next question is for the Premier on a different topic. Premier is laid to rest today, and I'm not sure if anyone has asked you what you thought when you saw that video, what went through your head, if you can describe that. And also,
I missed the first part, sorry.
I'm just wondering what...
Sorry, Travis, can you start over?
Laid to rest, that's the last what I heard.
Okay. So can you hear me now?
Yeah, I can hear you. Yeah.
Okay. George Floyd is being laid to rest today, and I'm not sure anyone has asked you what went through your head when you saw that video. I'm wondering if you can describe that, and as well, what immediate and concrete actions are you willing to take as Premier to fight anti-black racism now, other than convening a panel to ponder future decisions on the topic?
Well, everyone that saw that was it was disgusting. It was heartbreaking, and I know a lot of police officers, and I have yet to meet one police officer that didn't find that was absolutely terrible and disgusting and horrible, and it should never, ever happen again. You heard Jamil come up the other day. He's going to be working with our office. We need to work together, all of us, all communities in Ontario, to make sure that never happens. And we're going to continue reaching out to communities, getting people involved, listening to people. That's the most critical thing. is to listen and apply what you're hearing. If you hear groups of people needing, support in certain areas and different communities, then we're there to support them. I take this very seriously, and we'll do anything we can to make sure that we stop racism in this province, in this country. And I think we're all on board. All the public's on board, all the elected officials are on board, so we'll get it done with the support of the community.
Next question.
Next question comes from Randy Rath from CHCH TV. Please go ahead.
Hi, Randy.
Hi, Premier. Contrary to what you and Dr. Williams and the Finance Minister said yesterday, the Chief Medical Officers of Health in Niagara and Haldeman Norfolk say that they were not consulted before they were told that they weren't moving into stage 2, that the news conference you held yesterday was the first that they had heard of it. And the Mayor of Niagara Falls is extremely upset, saying that 98% of the tourism industry down there is out of work, and that it's going to lead to a catastrophe financially. What happened there?
Well, let's start off with Niagara. First of all, their cases ramped up over, I believe it was 15%, which is staggering. And I understand that was a big chunk of that was migrant workers. But still, when the numbers shoot up, our medical team, we have no choice. And I asked specifically, was everyone contacted? The answer I got was yes. So I guess the chief medical officer and ours are kind of going back and forth. I can see, but we'll make sure, without digging deep and pulling out papers and emails and everything else, we're all in this together. So it's not time to be finger pointing. So we're going to make sure that every community gets a follow-up call, but we aren't far behind. If we can get these numbers down, like hopefully in the next week or 2 weeks, we review this every single week. There's no one out there, Randy, that wants to get this economy going more than I do. It's absolutely critical. Now let's go to Haldeman Norfolk. I understand this is fluid. This thing is moving constantly, and I understand, one time you may say something and it may change. It wasn't longer than 2 to 3 weeks ago that we had the two mayors from there, I remember on TV shouting and screaming, saying they're going to fine any cottager that comes up. We didn't have the capacity, they were saying. We had one ventilator, we have a small hospital, we don't want anyone up there. And all of a sudden, bingo, they're out there getting a haircut saying they want everyone to come up. I get it, things change, I get it, but like, you can't have it both ways, and they had a massive spike. Well, they have a massive spike in the area. We have to do the responsible thing. People that live in that area are incredible. They're salt of the earth. I've been up there numerous times. I've talked to them. They're incredible people. But, you can't be telling everyone to stay away and we're going to fine you if you go to the cottage that you pay taxes for, and the most outspoken in the entire province, and a couple of weeks later sitting there getting a haircut and going against the protocol. So, like, give me a break. Like, really. They have to pick and choose.
Follow up.
But we'll get it straightened out. Hopefully in the next week, 2 weeks, people will be able to go up there and have a lot of fun.
Follow up.
So that protest today, where they sat and got a haircut, how would you characterize that behavior? I mean, that was actually an act of civil disobedience, wasn't it? Are they encouraging people to break the rules?
Well, the ironic thing about this, they were the same mayors, you remember, Randy, that were shouting and screaming in the whole province, the only two that were saying we're going to fine cottagers if they come up to their own residence. Like really getting out there and voicing their opinion, and that's fine. God bless them. But all of a sudden, to do like a 180 in a couple of weeks, as your numbers are going up in your area, it'd be totally irresponsible for us to say, okay, that's fine, open it up. They're the last two mayors in the whole province out of 444 mayors that I would think would be doing this, but this pandemic does strange things for people. I can't figure it out myself. You can't have your cake and eat it too, either one way or another.
Okay, last question.
Last question comes from Alison Jones from the Canadian Press. Please go ahead.
Hi, Premier.
Hi.
My questions are probably best for Minister Lecce.
Good.
Minister, I'm just hoping you can explain the reasoning behind having all childcare centres in the province able to open as of Friday, and yet not all areas of the province are moving to stage 2.
Well, we've sought the advice of the Chief Medical Officer of Health, who, as you know, has been a proponent of the concept of cohorting. He believes, and with his support, that we can responsibly cohort students in individual spaces, utilizing the space of a childcare center responsibly by using social distancing. Every child and staff is getting screened, as well as enhanced cleaning protocols. With this program, I think what it demonstrates, Allison, is what we've done in the past is informing what we can do in the future. The emergency childcare program we unveiled with the strictest protocols to ensure safety has largely worked, and it's worked province-wide in all regions of Ontario, urban and rural, English and French. In north, south, east, and west, we've seen operators open up. And so we are scaling that up, but we're actually enhancing the protocols. We're enhancing the penalties. We're enhancing the requirements imposed on our staff. We're requiring now the service managers to have to conduct, in conjunction with the local health officer, training to ensure in this new world that these staff are set up to succeed and that their kids are safe. So we believe there is a pathway to do that. We're giving notice to the sector to reopen following the training, following that work. Keep in mind, parents across the province have said to us that they want to have an option, a viable, safe option for their child when it comes to their ability to work. And so we believe this is important from an economic imperative to enable parents to return to work in the current phase or in phase 2 and beyond. But it's also underscored by our most important principle, which is safety. And this plan will keep kids safe.
And I just wanted to circle back to your question, your answer to Chris's first question on additional funding. I heard you list a lot of the things that had been done already, but I'm not sure I heard any promise of future funding to help out the centers as they operate at reduced capacity and still can't charge parents fees. I know your news release mentions leveraging the existing funding formula, but does that include funding for the centers that don't get the municipal operating funding?
With respect to the funding, what I've committed to when I announced this stabilization plan a few weeks ago is to make sure the system of support continues to reflect the needs on the ground. It's fluid, as the Premier said, in the context of COVID, and the same is true when it comes to the impacts on the private and public sector and obviously on childcare operators. And so our program is flexible. It enables the government to provide support on a need basis within our funding authority to help these operators get through the difficulty. And that includes additional support, for example, for deep cleaning or for PPE when required. And so my point is, the funding framework, the stabilization plan we unveiled continues to be relevant today. It continues to provide support, and we're going to make sure there's flexibility in our support to really respond to the challenges today, in the coming quarters, in the coming years, to make sure the sector is viable so that parents can return to work, as I say, with confidence that their kids are going to be kept safe.
Thank you.
That's great. Thank you, everyone.